All right, welcome back to the Elias Makos Show, 1022, right here on CJAD 800. Fax machines, handwritten notes, and paper files are holding Quebec's healthcare system back from fully embracing artificial intelligence. A report from the commission charged with advising the government on issues related to science and technology says these outdated ways are holding our healthcare system back from becoming a world leader. With more on this, let's go to John Kilday, McGill medical physics professor and leader of the Quebec SmartCare Consortium. John, welcome to the show.
Hi.
How bad is it, John?
I think it's pretty bad. It's certainly true that data are not connectable in the Quebec healthcare system at this moment, but I would say that Quebec is not very different than everywhere else. So this is a problem that's widespread, not just limited to Quebec.
Okay, so that I did want to touch on that, right? Because it's one thing if Quebec is some sort of holdout on a lot of paper notes and fax machines, but do we find this across? Is it the rest of the country also dealing with fax machines and things that are not connected?
Fax machines, I'm not sure, but I think, yes, definitely data that's not connected. I think this is a widespread problem that we're all struggling to fix.
Okay, one thing that I want to ask you about is, not just standing in the way of improving our healthcare system, but standing in the way of adopting artificial intelligence in order to deliver healthcare. Tell me about that aspect, because I know there are some people that will say, artificial intelligence near healthcare, I don't want to hear any of that because people are afraid of artificial intelligence, quite honestly. So tell me about that aspect of things. Why is that so important?
Yeah, so we talk about artificial intelligence, and I know there's all this discussion at the moment about ChatGPT and the concerns about it and the concerns about it in healthcare, but AI, artificial intelligence, is much more than ChatGPT. It's the use of learning from data. So it's the ability to draw connections from data and find things using data that we wouldn't otherwise easily be able to find as humans by ourselves. So there's really a lot of benefits to using AI in healthcare. Because, at the end of the day, healthcare is all about learning. We see patients, doctors see patients, and they're using their past experience to be able to diagnose those patients. We have scheduling systems, we have processes in healthcare, and we're constantly trying to improve them and to optimize them, and AI can really help out with this. But it can only do so if it has access to the data to be able to make the learning, make the connections that need to be drawn.
So what do we need? What do we need to do here? What changes do we need to make? What do we replace the fax machine? What do we replace the handwritten notes with?
Right, and I think this is where the report of the commission is really helpful. So it really lays down a number of recommendations to get from where we are today to where we need to be. And so, first of all, we need to replace the fax machine. We need data to be digital, because it's digital data, discrete data that we can use in the AI algorithms. AI algorithms can also read, handwriting, but that's not very efficient. So we really need to, first of all, make the data digital. Then we need to make the data findable, and the report mentions this as well. The data need to be available. We need to know where they are so that the different algorithms can connect them. And then really we need to do this in a way that is sensible. And I think what the report really is touching on is the healthcare system as we have today has kind of grown organically. It is as it is because we've done things the way we've done them in the past. But I think now is a good time to step back and say, how can we do better for the future? How can we learn from what we did in the past? Mm-hmm. And really it's about putting in place the mechanisms for when we buy software solutions in the future, that we're buying them under some sort of guidance. And we're not just buying them for our own little department, and we're not thinking about the bigger picture. And the report really goes into that, how to go about buying software in the future.
And we can't replace the fax with, I'll scan this piece of paper and turn it into a PDF and email it. That's not going far enough.
Exactly. No, that's just replacing one problem with another. So we really need to have a digital solution.
And do those solutions exist? Like, are there other countries that have solved this riddle and have an all-encompassing, every part of the healthcare system is on the same system, where the data can be shared and is searchable? Does that exist anywhere?
I think it's tough to say that anyone has really gotten it right, but I think Estonia is a country that is a really good example of how the government, and not just for healthcare, but the government in general, has digitized pretty much everything, and everything is connected.
It's so interesting. You're not the first person I've talked to that's brought up Estonia, right?
Right.
And say what you want. For some reason, when I hear Estonia is a great example of solutions, I'm surprised by that. Can you give me some examples of what they're doing that would be easy to implement here?
I think that if we look at Estonia, I think they're really taking a user-centered point of view. So rather than having, hospitals or having the government departments, manage the data in silos, they're really thinking about the data follows the citizen. So each citizen is a creator, a generator of data, and a consumer of data. And when you put the citizen at the center of their data, I think that's really where you can really make a difference.
Oh, you know what? So something just clicked in my brain when you said that, right? Because it certainly seems like here, it's not about the client, the consumer, the citizen. It is about the organization, the government body, right? It's about the hospital system. It's about the SAAQ and those different silos and how we collect data. That is eye-opening here.
I think that's the way we've done things is we've always tried to build our solutions where we identify the problems, but the report does talk about taking a different approach going forward, a co-design approach, an approach of involving the end users. I think there's two of the recommendations that talk about involving the end users in the design and involving the end users in the providing guidance on how to purchase solutions going forward. So
let's say we can do all that. Does that help solve? Because there's other issues in our healthcare system, doctor shortages, infrastructure issues. So can that make those problems disappear or get better too? Or is it really... Yeah.
Yeah, actually, and the report mentions this a little bit, where it says that, the benefits of being prepared for artificial intelligence are not just for artificial intelligence. The benefits of having a scheduling system where patients can book appointments and can confirm appointments or, cancel appointments, the benefits of having all the data connected and being able to optimize the use of resources will actually save on resources and will in the long term save us a lot of money in a healthcare system where the costs are increasing every day. Do we have a government and healthcare minister who is receptive to this kind of thing? I mean, I just know in the last few years, Click Santé, there are a lot of times where I'll say, wow, Click Santé is pretty good. Are we moving in the right direction? It's a good question. I think the answer to that will really be in terms of what's the receptiveness to this report. I think this report is really nice because it really lays down a number of recommendations. It's not just saying, we have a problem, please fix it. It's saying we have a problem, here's how to
solutions.
Fix it. Here's how to put in place the guidance for the future.
John, we're going to have to leave it there. I want to thank you for your time.
Excellent.
That's John. That's John Kilday right there, McGill medical physics professor and leader of the Quebec SmartCare Consortium.